Well, I thank the gentleman from Connecticut for his efforts, as well as Congressman Kennedy for his stalwart work on making sure that we do the right thing for Americans. And my friends, Ohio is struggling. Ohioans have lost their job over the last 8 years in record numbers. In fact, we have not crawled out of the recession from 2001. And so many Ohioans, just like so many Americans, are one accident, one medical emergency, one diagnosis away from complete and utter bankruptcy. Yet we spend here in America, like Mr. Kennedy said, more than any other industrialized country in the world on health care. More than any other industrialized country, yet our life expectancy is on par with Cuba. We as a nation spend nearly $12,000 for family coverage. $12,000 of disposable income is going for health care insurance. My friends, this not only makes moral sense and makes sense in terms of the right thing to do, but it makes sense in economic terms. Let me tell you this. We have to cover every American. I have to have a system that covers every American. We need to emphasize prevention, and we need to make sure that health care is portable between jobs, something that has been played out so often in Ohio as Ohioans transfer from job to job because of the downturn in our economy. And we need to end the discrimination that's based on pre-existing conditions. And I tell you, Mr. Speaker, there's no issue more important than this one, because this issue alone is costing millions of jobs and costing thousands of people from seeking preventative care. We spend 75% of all that health care money, nearly $7,000 per person. We spend 75% responding to chronic illnesses, illnesses that could be treated if we just saw routine visits to the doctor. Chronic diseases like diabetes, asthma, and heart disease. And we see that nearly only 4 cents on every dollar, Mr. Speaker, 4 cents on every dollar is spent to promote healthy lifestyles. There is a huge disconnect. And when we see the fact that big insurance companies block and prevent people from going to see routine visits to their doctor, we are actually costing the American taxpayer, small businesses, and larger businesses that have huge legacy costs more money. And in fact, a recent study, my colleague from Connecticut, I'm sure he knows of this one, a recent study suggested that $84 billion a year is spent by big insurance companies to block and deny claims from you going to see your doctor, whether it's for a diabetes treatment, whether it's for asthma or for a heart condition. And that same study pointed out that nearly $77 billion is all that would cost to cover the nearly 50 million uninsured or underinsured Americans in this great country. We must take action now, because let me give you two scenarios before I yield back my time that has been played out in Ohio over the last 8 years. That factory worker that worked at Rubbermaid, where the plant closed and the job went overseas, now they have got to find new work. And they also have to find new health care insurance. And when you see those individuals struggling, those families try to send their kid to a dental appointment or try to send their young family to go see their physician because they have some sort of ailment, maybe the worker themselves, Mr. Speaker, had diabetes and they can't go see routine visits to their physician now. So they get an ulcer on their foot. It goes to a point where they now have to go to an emergency room to seek care. And they cost all of us paying into the system 4, if not 5 times more by seeking emergency room care versus seeking care from a primary care physician. So we are actually losing money, costing ourselves more money by not insuring everyone. We need a robust system that allows employer-based system that is portable, that they can take from job to job and the like. So if that person now who worked at Rubbermaid is working at Walmart, they should have a portable health care plan that allows them that transition period, that allows them. But what we do now is we have to pass an extension of COBRA benefits because the Congress, and especially our former president, did not address this issue and take it head on. Small businesses are asking for relief. American families are asking for relief, and it's about time we deliver that for them. I yield back my time.
Well, Mr. Boccieri, thank you very much for joining us. You know the statistics. You just look at the auto industry, and that statistic that we've heard over and over again, that $1,500 of every automobile produced in the United States goes to pay health care costs. The comparable number to our domestic auto manufacturers for their competitors in Japan or all over the world is nearly zero, because they don't bear the full burden of paying health care costs. Now, they pay it a different way. They pay it through taxes to the government for a different system, but they're paying for systems that cost 11 or 10% of their GDP, where we're paying for a system that costs 16 to 17 to 18% of our GDP. It's a tremendous competitive disadvantage for small businesses that are trying to pay those premiums, and also for those large manufacturers, Mr. Boccieri.
Well, and I would submit to my colleague from Connecticut, who has taken on this issue headstrong, and we appreciate that a recent poll in Ohio from the University of Cincinnati showed that nearly 20% of all Ohioans, 11.5 million people in Ohio, nearly 20%, 1.4 million Ohioans from age 18 to 64 lacked health care insurance. So that person who's transitioning from job to job, who can't provide the health care insurance they need, makes economic sense that we cover them to make sure that they can seek treatment, because it's going to cost us more down at the end, 4 if not 5 times if they have to take their child to a hospital emergency room to seek routine care that they could have done if they just went to their physician. It not only makes moral sense, it makes sense for all of Americans. And I have to tell you this, we hear the diatribe and the arguments from the other side of the aisle. But my colleague and the speaker need to know this, that in 2004, George Bush's Secretary of Health and Human Services, Tommy Thompson, flew to Iraq with one of many billion-dollar checks in hand to make sure that every man, woman, and child in Iraq had universal health care coverage. And what he said is that Iraqi families and their children deserve health care, but you do not. And we're going to spend American taxpayer dollars to make sure Iraqis can go and see routine care with their physicians, but not American families. And I think that is a huge disconnect. And we need to talk about that, because we are building brand new roads and bridges and hospitals and wastewater treatment facilities over in Iraq. But when it comes time to put Americans back to work and to ensure that Americans can seek routine care with their physicians and with their family doctors, we hear nothing but blocking. And I tell you, Mr. Speaker, if we were to give a Heisman Award, we would give it today to some of the dialogue I heard today on this floor. This is about putting America first, putting Americans first, putting Americans back into their doctor's offices so that they can have valuable health care and they can seek routine care. It's about the American family and putting Americans first. That's what this stimulus and economic recovery package is all about, and that's what providing health care insurance to every American is about. I yield back my time.